I'm a sophomore, one of the St. Ben senators who was on the Mental Health Week planning committee, and we have Nathaan here tonight. So thank you to all of you for being here. We're really excited for the rest of this week, so continue to just look at all of this Instagram stories for events and such. But I'm happy to introduce Nathaan Demers, Dr. Nathaan Demers, who works as a psychologist for Grit Digital as the Vice President of Clinical Programs and Strategic Partnerships. Nathaan is very passionate about people. This passion has led him to an enriching career as a clinical psychologist, filled with a number of twists and turns, working across a variety of settings. Nathaan is an active traveler and athlete. These aspects of his life have inspired him to think beyond the traditional confines of mental health care. He strives to find innovative ways to expand the reach of mental health services to improve the lives of others. While Nathaan is fascinated by all areas of psychology, his passion lies within the positive psychology movement, working specifically in preventative behavioral health. So you're all in for a treat, and please help me welcome Nathaan.
All right, thank you. Noise is still going well? Not too loud? Sounds loud to me, but if you're good. Okay, perfect. So huge thanks to Evan, Student Senate, Michael back there, and everyone for having me. It is so cool to be here. I was like that nerd who loved attending these when I was in college, so thank you all for being here. And my title, unfortunately, is a little boring. I think this talk's actually going to be a lot more fun than what that says there, so bear with me. But again, my name's Nathaan Demers. I'm going to get into a little bit more about me and how I got here and all that, but quick agenda. A little bit about me. Would love to learn a little bit about you all. Talk about treatment trends in light of this little thing called COVID that we're all living in. And then talk about individual and institutional strategies to try and raise mental health awareness and take advantage of this tidal wave of conversations about mental health that have been happening in light of COVID. And then just review some take-homes. That sound okay to everyone? I can't change too much at this point in time, so you're kind of stuck with it. So I know normally you don't encourage pulling phones out, but I want to do some live polls throughout here, so I assume most people have a phone. There's a ridiculous URL up there. It is pollev.com/classybunny059. The reason it is that name is it costs $500 to customize that, and I didn't want to pay $500 for that. So you know what? Classy Bunny works just fine in my opinion. So when you go to that, you can just skip the name part. It'll say input your name. You can literally just hit click, skip. That'll get you there, and we'll hopefully start seeing some response come in. And we'll be doing this throughout the presentation. So if you can, keep your phone handy, not on Instagram, but ideally handy for this, that would be awesome. Here we go. Nice. I personally really like watching this live, type of thing. Got it. So a lot of yeses, some nos, and a lot of sometimes. That makes sense. That's what I was expecting. Responses are still coming in. People look like they're looking hard. All right. I'm going to go to the next question. Sorry if you haven't gotten there. Persist. You'll get there. So same question, but more focused on mental health. Someone might have tried to answer for the last question. You can change your answer. So I think right off the bat, we can already see that there's a pretty significant trend here, that there's a pretty big difference between the attention that we are individually putting into our physical health and nutrition and then our mental health. And I don't think that's going to come surprising societally or individualistically either to any of us. But with this presentation, this is one thing I really want to talk about and get to the bottom of, in that obviously your campus is working really hard, guided by your student senate, to raise awareness about mental health, both at the individual and campus level. And this is one thing that if we can put a dent in, is going to get us that much closer to being where we want to be related to mental health. So before going further, I want to do a quick exercise. So just turn to the person next to you, scale of 1 to 10. Quickly, just let them know how you think you're feeling. Real quick. 1 to 10. All right, I'm going to reel us back in. Love the conversation. All right, so everyone with me. I want to do a quick breathing exercise with everyone. So bear with me. It might feel a little bit silly, but I want you to give it a shot. So everyone put your hand out in front of you just like this, right or left. I don't care. It doesn't matter. Start all the way breathed in, and then slowly breathe out. And I want you to time it so that when you're all the way out, your hand is all the way closed in a fist. So do it on your own time. I'll do it on my own time too. So. And same thing, breathing in. And really try and focus on your hand so that when you're all the way breathed in, you're timing it perfect so that your hand's open. And same thing in reverse. And as you do it, when you open your hand, just notice all the little crinkles in your skin opening up, your joints expanding. And when you're folding it back over, just notice each finger touch your palm, what it feels like when your thumb folds over. Let's do 2 more. All right, so come back. Turn to that person that you told how you were feeling before. How are you feeling on a scale of 1 to 10? Same, different, higher, lower, hopefully not worse? How many people felt a little bit better? How many people felt the same? It's okay to be honest. Cool. How many people felt worse? So no real downside to taking 20 seconds out of your day to doing that. One more little exercise. Turn to a person next to you, even if you don't know them, and I want you to give them a compliment. All right, I'm going to pull us back in. Sounded like some great compliments out there. Good work. So how do you feel? Any different after sharing a compliment or receiving a compliment? Better? Anyone? Show of hands. Got it. That was a very strong hand. I hope you got a great compliment. Anyone feel worse after that? People feel about the same? You can raise your hand and say you felt the same. Wow, compliments really did it. Okay, cool. So these are little things that we can do throughout our day, whether it's breathing exercises, whether it is expressing compliments or expressing gratitude, that all the research says can have as much of a positive impact on our mental health as doing formal meditation. So these are the things that if we can push ourselves both individually and sort of collectively, as a campus perhaps, to normalize and make it common practice when maybe you start a class before you take a test, or whatever it might be, to do these things, you're going to lower your stress. You're going to place yourself at lower risk for developing behavioral health or anxiety or depression later on the road. So try and hang on to those things, and we're going to circle back to that in a minute. But before going any further, I do want to express a quick gratitude. Whenever I travel for work, I always have to give a huge thank you to my family for letting me be gone. So this is what's happening at home. I just got this a little bit before on my flight here. Oh, is it not coming through?
2 green ones?
2 green ones.
Okay, here's one. Uh-oh, you got a booger jumping out of there. We gotta blow that. Hi, Fallon. Come here. Look. Hi. Who's that? Is that your brother jumping? Does he have a crown on his head?
That's Fallon.
Hello, Fallon. Here you go. Okay, now show us your dance moves.
So that is my life at home when I am not here. But expressing gratitude and taking that moment, one thing I did with my team was I literally just sent out a spreadsheet to everyone and said, once a day, all I want you to do is write something you're grateful for on it. And everyone did that, and we also scored how we were feeling, and at the end of the week, everyone indeed did feel better. And something that I didn't even plant the seeds for, folks on my team said, you know what, if I was having a bad day, one thing I did was I pulled open that spreadsheet and quickly looked at all the things I was thankful for, and that had an incredibly big impact in that moment of helping me push through that big task or overcome the negative feeling I got when I had a tough conversation, whatever it might be. So again, little things that we can do that can go such a long way. I have to remember what slide's next. Okay, so a little bit about me and how I got here. So I am a clinical, I'm jumping ahead of myself. So as you pointed out very well in my introduction, I am an athlete, I am a traveler, I'm the father of 2 kids and an outdoorsman, and all those things really pushed me to not necessarily settle for, this is healthcare and this is how we do it. I've always been trying to sort of push a little bit beyond the way we normally do things. And that has been so fun for me to just conceptualize things that haven't been done. So I started my career working at a therapeutic boarding school in Montana. So it was for adolescents with severe anxiety, depression, suicidality, and substance use. And that gave me the full confidence that, you know what, I want to be a clinician. I definitely want to be a psychologist. And as many of you know, if you want to do therapy, you have to get a higher level degree. So with that, I decided to go to the University of Denver and get my doctorate. And during that time, I worked with a number of different populations. So I first worked with court-mandated populations, so perpetrators of domestic violence, drunk driving, things like that. And amazing work, so much need. And I personally found that working with parole and the justice system was just really challenging and wasn't the right fit for myself. From there, I worked in a neuro and inpatient burn ICU, very high intensity setting at the University of Colorado Medical Center. And I loved that work. It was fast-paced, you never knew what you were gonna see, and my focus area was also in trauma. So it was a great fit. From there, I worked in an integrated primary care center and a college counseling center at CU Boulder, so large state university. And I always knew I would kind of gravitate towards that, again, leaning towards upstream behavioral health and wanting to help young people ideally build grit and resilience and coping mechanisms to avoid the downstream development of mental health challenges, if we will. I use that term very loosely, I don't like it. But from there, that's when I really decided, you know what, I'm pretty frustrated by the way that we're doing things. So we'll get into the research behind it, but I had 60 students on my caseload, and I only had 20 clinical hours per week. So if you do the math pretty quickly, I couldn't see everyone on a regular basis that I wanted to. And then when I looked at the research, we saw that a lot of students unfortunately slip between the cracks and never get to therapy before they need it, and are dropping out or experiencing the negative implications of doing so. So I firmly believe that we could do better and get upstream. And that's when I found a nonprofit called the Western Interstate Commission for Higher Education Behavioral Health Program, which is a mouthful. But our mission was to bring quality mental health services to rural and underserved areas in the western 15 states and American territories in the Pacific. And I just fell in love with this big picture work. So instead of a student being my client, all of a sudden the state of Alaska was my client, or American Samoa. And we were trying to tackle these really big, audacious problems. And what I thought was so cool is historically, a lot of times clinicians aren't leading that work. Someone with maybe an MBA was doing that. And while that works from a business perspective, someone with an MBA doesn't know the ins and outs of what it's like to give and or receive therapy in most cases. So I just loved the impact I could have. And from there, 5 years ago, that landed me at an organization called Grit Digital Health. And we largely act upon that same mission of what I just shared at Witchy, but we do so with technology, which we'll get to in a little bit. But that story all started, oh, see, I did it again. Back to to these things, your phones. So I already asked how you're doing today, but I think this is another level of getting there, in that at dinner, for some folks that were there, some great questions, talked about one of the most important steps in maintaining our own well-being and achieving the goals that we're hoping to in being good leaders. And one of those is really being self-aware. not just on a big picture of what our strengths are, where our growth edges are, but on our state in the moment. And I love, because I'm a psychologist, big wheels with a lot of emotions words on them, because a lot of times we forget. We often just say, I'm either happy or sad, when the reality is there are so many words that can describe that in between. So I'm sorry for whoever's feeling let down and provoked, but I am glad to see that there are some people feeling pretty good, but there's also a lot in the fearful. We're pretty all over the place for today. And it's a Monday night, it's the middle of the semester. I think that makes a lot of sense. So thank you to yourselves and to one another for being so open with how you're doing right now. So I know a lot of people are from Minnesota, but I'm curious if there's folks from elsewhere. This one's pretty easy. Minnesota, we'll just call, yeah, up in that general area. Good work. I like it. So we have a nice little breakdown here. So I'm from college. I'm originally from Massachusetts, did my undergrad at Middlebury College in Vermont, moved to Montana, as I mentioned, and then I've been in Colorado since that time. So we have a great representation, both nationally and internationally, which is super cool. Thank you. Now, this is a bit of a tougher question. So in your opinions, what's the #1 mental health and/or well-being challenge that your universities are facing, in your opinion? It doesn't have to be huge or profound or anything. It could be as simple as people don't know how to get to services. Motivation is a great one. Burnout, totally agree. That is something that has always been top of mind, but is definitely even harder in light of COVID. Prioritizing your time for yourself, great one. Anxiety. Balancing too much, classic great small private liberal arts school problem with everyone pushing themselves to be the best they can. Feeling welcomed, interesting. So we'll address a lot of these. So these are my guess is these are coming in a lot faster than they're populating, so I'm sorry if yours didn't get up here. I'm gonna give it one more minute to just get a few more. Stress, making bonds with new people. I assume these are all sort of resonating with most people. Nothing's really out of left field here, right? Am I right in that? Little head nod, people are still awake, doing okay? Great, glad to hear it. Awesome. Well, not awesome on the challenges, but. So you are all not alone. So in our work, we work with over 180 campuses now, and we did a recent poll, and we heard loud and clear that 98.7% of students strongly or very strongly agreed that my campus needs to continue expanding offered mental health services. And then furthermore, 75% of students said that it's really important to make sure that whatever sort of outreach or things you're providing speak to my identities as a person. And that's so important normally, but in light of COVID, I'd argue that importance has gone up even more because we were all impacted in very different ways throughout COVID. And I'm sure many of you are familiar with the concept of the dual pandemic and that we know there's a lot of populations who were disproportionately impacted by COVID, specifically in terms of mental health. So with that, we have to make sure that what we're doing is catered to folks because a one-size-fits-all is simply not working. And think of Spotify, think of your Facebook feeds, Instagram, everything. It's all personalized. So if we're not meeting that, it's going to be pretty hard to make sure that you're connecting with that. So I'm going to give you a quick background of our organization and how we started. I'm going to show a video. I have to give you a warning. There is a bad word in this video. It is bleeped out, but I do have to give that warning. Is that okay with everyone? We're going to make it. If anyone has problems, feel free to plug your ears or whatever it might be. I think I have to do this again because the sound wasn't working. Sorry for all the noise that you're going to get. Jack, if you have a better idea, I'm open. This will work. All right. Can people hear that?
Whether your son of a bitch boss has you working late or you're stuck behind a 105-year-old lady doing 7 in the fast lane, breathing exercises are a subtle yet manly way to combat stress and anger. Watch as I demonstrate. Close your eyes and take a deep breath through your nose. Feel the breath travel down your gullet and into your belly. Now, slowly exhale. Fuck. Again. Fuck.
So this is Dr. Rich Mahogany. He's a fictitious doctor that we made up. We branded him as part football coach, part drinking buddy, and part therapist. And the reason we made Dr. Rich Mahogany is the state of Colorado came to us and said, we want to address the extremely high rates of suicide we see in our state. And when we looked at the research, over 2/3 were specifically working-aged white men. And when we talk about stigma, rural Colorado, just like rural Minnesota, men don't want to talk about mental health. It's a pull yourself up by your bootstraps type of mentality. And when you look at a lot of mental health campaigns out there, they unfortunately were really missing the mark. They're head in hands, they're clouds on a gloomy day, and people don't want to go explore that unless they need it. And medicine realized, in the 1970s, hey, let's treat high cholesterol instead of waiting until someone's having a heart attack. And we thought, why can't we do the same? Why can't we make it fun and engaging and a cool thing to check out your mental health rather than waiting till something's wrong? So with that, our goals for Man Therapy were to reduce stigma, increase help-seeking behaviors, decrease suicide, and do so in a sustainable way, which is a pretty tall order. But as you can see, we made a website. And I know you didn't see the website, but it is an evidence-based website. We'll talk about that in a minute. But we know that once people get to this website, they are indeed more likely to decrease their symptoms of depression, and they're 40% more likely to actually reach out and connect for mental health support, which is a huge win. But one of the challenges, and I think folks often forget this with any health-related intervention, is you can have the most efficacious intervention in the world, but if you don't get people to it, you're not doing your job. So when someone was stressed out, when was the last time you went to cdc.org to look for ways to cope? Probably never, is my guess. Same with National Institutes for Mental Health website. So we had to make it fun and engaging. So with that, we made some pretty cool, funny assets to meet men where they work, love, and play. So there's posters that hang in urinals. There are primary care campaigns, one of my favorites somewhere over here. It's like a physical for your feelings, but you get to keep your pants on. That's a great one. My primary care doc, I brought him a stack, and I just saw him after 2 years because of COVID, and they're actually all over his office. And he said the amount of conversations that I've been able to have because of these posters is incredible, whether it was someone for themselves, for a loved one, for a father, a brother, or coworker. Sometimes we just need that nudge to make it a little bit more approachable to start having these conversations. But that success actually led us to a partnership with Facebook where they donated us ad credits, and we're able to target men in occupations at risk for violent behavior, depression, and suicide. And it's actually one of the most impactful campaigns they've ever had. Like, we outperformed brands like Coca-Cola and things in terms of conversion rate. And we think it's because of two things. One, it was really engaging. We learned our target population and we leaned into those stereotypes that would get them talking. And B, I personally also think that there's an appetite to talk about mental health nowadays if we meet people on their terms. I just went the wrong way. So the impact has been pretty amazing. We did this site, we thought it'd be around for like a year or so and would probably disappear, but we launched it in 2012. When we launched it, the New York Times picked up a piece on it, The Atlantic did a piece, 20 states adopted it, Australia made their own version of the portal. And as you can see, we've had over 1 million hits to the site, great average time on sites. Our head inspection is essentially a mental health screening tool, but it's funny. Dr. Rich kind of gives you an intro and lets you know how you did. And when was the last time anyone took a Beck's depression inventory for fun in your spare time? Probably not something you do in your dorm room. But this was fun and it's engaging, and we have men taking it and sharing it with other men because it's funny. And the win is that we're getting people to take mental health awareness tools. But what made it even cooler is we had this funny campaign that we knew was getting a lot of eyeballs on it, but the CDC came to us and said, we'd love to actually research this. So they gave us a grant, or researchers a grant, that was $1.28 million, which is actually 5 times more than it cost to make the site, which we thought was incredibly ironic. But they did a 4-year longitudinal study. It was a randomized controlled trial, and they found 3 things. They compared it to traditional screening tools. The first finding is that both screening tools work, which is awesome. But secondly, they found that man therapy actually worked a lot better. And it it increased social support, decreased structural barriers. For those of you at dinner, we were talking about things that can get in the way of connecting to mental health. And it decreased psychological, that should say aggression, but psychological aggress, I guess. And then the third one that was really interesting, and we're applying for more funding for this, is that we found an unexpected improvement for men who identified as non-heterosexual and non-white, which we thought was kind of counterintuitive, because as you saw, Dr. Rich is indeed a white male. So we're trying to understand that more, but we're so pleased to know that it does indeed resonate with folks across the spectrum. And we have some ideas, but we want to confirm them. So that was man therapy. So we knew we were onto something in terms of, really branding and making things for a specific target audience. And we got a call from Colorado State University, who's up the street from us, and they very tragically had 17 students die by suicide in 2 academic years. And most alarmingly, they very quickly realized that the majority of those students weren't on the campus's radar as having any challenges. They weren't talking to RAs about it. They didn't go to the counseling center. So they said, we have to get upstream of this. We can't wait until someone's presenting for services because that model clearly isn't working. So they said, you did this man therapy thing. I wonder if we can put our heads together and make something new for students. So we decided to do so. And before jumping in, another quick poll. In 2020, pre-pandemic, what percentage of college students said that their mental health negatively impacted their academic performance in the last 4 weeks? Thanks for keeping that so handy, everyone. And great guesses. So the answer is actually D, at 74%. And that number is actually up into the mid-80s in light of COVID. And why this is so important is that we know mental health, unfortunately, as I think many of you are here and folks at the dinner alluded to, that you want to learn more. You're stressed, you're juggling too much. There's a lot of things that are getting in the way of really being positive about our mental health. So when we look at the stats, I'm not going to read all these, but we can see it's unfortunately not a pretty picture of what's been going on in terms of mental health on college campuses. So we knew that if we could get ahead on that and even help move the needle 5%, 10%, maybe we shoot big and shoot 20%, that would be a huge win for students in mental health in general. And I'm definitely not going into these stats because you all know it. This is what happened in terms of COVID. We had this incredibly high baseline of mental health challenges, and unfortunately, COVID exacerbated many and really shed light on a lot of cracks that we have in our system. But rewinding back to when we did all that research in 2016, so students came to us, CSU came to us and said, can we help solve this problem? And we said, yeah, we'd love to. So we took man therapy up to Colorado State, and we tested it with students. And they said, we like it, we get it, it's funny, but it's for my white dad. And we said, that's a fair critique because it's not made for college students. So we started co-designing, and we started asking questions of what would it look like to have a tool that you would want to go to that would help you address your mental health. So this is our research process. I'll walk you through it really quick, but when we observe a need, so that there's a lot of unmet need in terms of mental health. From there, we do research, we brainstorm ideas, we make some hypotheses, and then we actually start to prototype things. So our first prototypes might be something as simple as one of our designers sketching something out, like, hey, what do you think of this well-being portal, versus meeting with a therapist in the bar on campus, like just thinking big. And then from there, when we get some hits, we start to actually experiment and build and put things out there. So what we heard from students when we made this was 5 key things that would be essential to getting them to use a tool. And I'd be very interested if you just nod, yes, this makes sense, or it doesn't make sense to my experience. But the first is I wanted to make a mental health fitness center. And the first thing that a lot of students said was, you know what, that doesn't sound like fun. In fact, it sounds like work. And you know what, mental health isn't my thing. That's not my problem, so I don't need to use that. So if we made it just about mental health, we might miss a lot of students who don't identify with mental health being a challenge. Even though a lot of students said things like you said, I'm really anxious, I'm really stressed, I'm too busy, I can't find balance. But a lot of times we don't think of that as mental health, so you might just pass up on that. So we knew it had to be bigger. The second thing students said were, you know, I know where to go if there's a crisis. I need something that's going to help me be more resilient. It's going to help bolster the tools in my toolbox. So it had to be upstream. If it's digital, you all know, if the user experience stinks, you're not going to use it. It has to look and feel cool. And then these last two were super important. So students said, if I go to this thing and I type in sexual assault, drug abuse, dropout, and I'm worried that someone's going to come knocking on my door, there's no way I'm going to use your thing. Or I'm going to check it out, but I'll just lie and not tell you what's really going on, because I don't want to risk that. So we had to be confidential. But as we started, we also talked about personalization. The experience on one campus is drastically different than the other. And the experience of a student athlete is different than a student veteran, which is different than a non-traditional student who is working and has kids, for example. So we had to make sure that we're addressing all those things. So our well-being model got much bigger than just mental health. So we came up with 3 domains. Thrive is all about physical and mental health, all the things you'd imagine in there. But then when we look at Succeed, it's about finances, basic needs, academics, and career path. How many people here are stressed about academics at some point or another? I see no hands not raised, I don't think. So with that, we know, and I know, if I can help address your stress around academics, that's inevitably going to help your mental health. That's going to help you be healthier. It's going to help you have a little bit more time. And then Matter's all about purpose, connection, resources, relationships, and things like that. And again, if we could help you with academics and give you a little more time to hang out and have some fun with friends, we know that that is the single best predictor of being happy, healthier, and graduating. So this is a 3-legged stool, and we had to make sure that we're addressing all those things. And the mental model, so this is basically how we heard that folks approach help seeking, is as followed. So when students said, you know, I want to check out a well-being thing, these are the 2 places that I want to start. I either want to choose what I want to focus on, because I know, you know, when I'm stressed about academics, I want to jump right in. And I want to do so by either getting advice, learning skills, or getting help, so going to a campus resource. Then I want to track my progress, get reminders, and then check in with how I'm doing. And the other route, I'm sure a lot of people I know I did when I was in college, I fell in this bucket. I knew I was stressed, I knew I didn't have balance, I was overcommitted, and I didn't know where to start. I didn't know what was off, I just knew something didn't feel right. So other route is starting with some quick assessments that are fun and engaging, like that man therapy head inspection, to get going. So this model's been really effective. We've scaled, we're at over 180 campuses now nationwide, and I'm super proud, oh, I put that slide in the wrong place, that we're working with you all. Did folks know that? Has anyone heard of you at, I always mess up this acronym, and I hate that I do it, CSBSJU? Woo, I'll take it. I'm practicing that for a while. So you at whatever I just said, is available on your campus, and we'll share a little bit more about what it is and how it works and all that. But I want to take a quick, big left-hand turn and just talk about treatment trends in light of COVID, because I think something that's so important to remember is we have all lived through a global pandemic that we have not seen anything like it before. And I think we've all sort of accepted it as our reality now, and we're adjusting and coping and doing the best we can. But it's also important to reflect on that and understand what sort of impact that's had on our collective mental health. So pre-COVID, let's just look at some mental health trends that unfortunately aren't the most glorious. But from 2009 to 2019, we saw the number of alcohol and drug-related and suicide deaths increase by 52%. So not a great trajectory. One thing that was very positive, in 2019, we actually saw a decline by about 2%. And that was actually the first decline we've seen in quite a long time, since 2005. Grab your phones. What does the preliminary data suggest about the suicide rate in 2020 compared with 2019? Good guesses. And the preliminary data actually shows that we had a slight decrease, which we don't know why yet. There's a lot of intricacies when it comes to suicide data, but it's very interesting to see that we don't know exactly what. But it's great to see that we didn't see a huge increase. Secondary question. What do we think we saw in terms of mental distress, substance use, and drug overdose? Now I think you're all wondering if this is like a trick question based on the last one. All right. So you got it. Unfortunately, all these things experienced a very significant increase. So we know overdose was up 20%. When you look at some of these stats on the right-hand side, we know a lot of folks were at home coping. There were incredibly difficult situations in terms of finances, social support, and all that, and not to mention just the sheer loss in that I'm sure everyone in this room was either directly or indirectly impacted by a COVID loss. So the other thing that we know is in light of COVID, unfortunately 4 in 10 adults are endorsing symptoms of depression, which is up from about 1 in 10 prior to that. And then this one I think is fascinating. So this is a graph of, can you all see that? The contrast isn't quite there. You can see it well enough. Thanks. So this is what happens in terms of treatment trends throughout the pandemic, in terms of actually getting out there. So Minnesota, as you can see, there was a bit of a decrease and then a net increase of 14%. Some places had an overall net loss. When you look at Denver, I'm very proud because that's where I'm from, we saw 65% increase. But when we zoom in even further, this data I find fascinating. So right when the pandemic hit, of course, telehealth went through the roof. Not surprising, plateaued, kind of stayed there for a while. But the unfortunate part is some other services, so assessments and testing, that's where folks get diagnosed. They figure out what might be going on and figure out ways to get connected. Unfortunately, there's been a decrease in that. And while overall behavioral health seeking treatment went down but then went up, unfortunately, because there's so many folks experiencing behavioral health distress, there's still a huge gap between folks seeking services and the need out there in the world. That makes sense? I don't know how articulate I was. Most people got it, I think. Okay, great. So the other reason this is so staggering is that there was, I hope most people have a primary care doc, but in light of COVID, for example, I didn't see my primary care doc for 2.5 years, and a lot of other folks didn't as well. Why that's such a challenge is that when we see our primary care provider, a lot of times that's where we're actually connecting with and getting screened for mental health. A lot of times, the research shows that 70% of individuals going to their primary care provider are actually there for something mental health related. Whether it's stress headaches, difficulty with indigestion, focus, insomnia, those are all things related to behavioral health. And unfortunately, these have been slow to rebound. So for us, the question becomes, how do we reverse these trends? How do we start to get ahead of this? Because we know that picture is not all that pretty. And this is a treatment continuum. So this is all the way on your left-hand side, is things that we can do that are called primary or tertiary prevention. Tertiary, ugh. I don't sleep because of that 11-month-year-old, so I often have word-finding difficulties nowadays. But with that, think of vaccines. When we're providing people vaccines, that can prevent the development of downstream, ideally COVID, altogether. So that's what these activities are. And the more that we can do that, the more we can catch folks before there's challenges. Of course, we need to keep doing the treatment thing. We absolutely have to. But if we don't get ahead of that, what we're going to do is run into this really big bottleneck of folks seeking services once our system and folks sort of catch up. So I'd love to now shift to talk a little bit about institutional well-being and really build upon what Senate has been doing and provide some strategies that can hopefully at least spark some ideas of what can be done on campus in the here and now. So the Education Advisory Board, anyone heard of them? Nah, got it. They're a huge organization. They have about 5,000 institutions of higher education around the world who are members. They do a ton of research and drive some really cool stuff. But they did a report and they interviewed myself and our team and came up with 3 things that are super important in reversing these trends and trying to get ahead of mental health. So the first is setting an institution-wide vision for well-being. Historically, a lot of well-being and mental health things lives in Mike's department, in the counseling center. And if you don't know Mike, that's Mike back there. He's great. You should get to know him. But what's so important is Mike is great in his department at providing therapy, at health promotion, but think of all the other spheres on campus where you receive communications. Academic advising, orientation, dining halls, all those things are places that we can actually intervene and inject well-being and mental health information. Secondly, we have to work across silos. I'm sure you've all felt this on Senate. Left hand doesn't know what the right hand's doing by mistake. And that can be so detrimental because we can waste resources duplicating efforts by mistake. And then lastly, we have to find ways to implement personalized well-being solutions for students as well as faculty and staff. We know that if we don't have a healthy campus community, unfortunately, we're not going to have the thriving community that we all want. So we implemented, as you know, CSB SJU. I could say it fast because I saw it. If you haven't checked out the site, I highly recommend it. I'll give you a minute at the end to create an account if you're interested. But this is an example of setting an institution-wide vision, largely led by your student senate, saying this is something we want to do differently. This is something we want you all to be able to access 24/7 in your dorm room. If you don't want to reach out for support for whatever reason, that's confidential and anonymous and available 24/7. But just to show you the impact that that's had at some other institutions when implemented right, we did a large-scale launch at the California state system. Of course, a little bit different than here, but a lot of the same principles apply. So what they did to get things going was actually elevated it way beyond counseling. So this is at CSU Fullerton, where the president of the institution actually did a bunch of social posts on why he's excited about raising awareness about mental health and bringing in this new tool that can help students 24/7, 365. So I know at my institution, we loved our president. Whatever the president did or said, we would all check it out. So this is, again, one way that you can start to engage. And it was great to see someone from the recorder, I don't know if you're still here, but at dinner, being able to report on things like that, and again, make it a priority is incredibly important. But this was another great one. Do you all have a learning management system like Blackboard or something like that? When you're on that site, are you like having fun or is it kind of stressful sometimes? Probably pretty stressful, I'd agree. So historically, campuses a lot of times say if it doesn't have to do with academics, it's not getting in Canvas or Blackboard, because that's just about academics. Yet we know mental health and well-being is having even more of an impact on academic success than actual issues in the classroom. So we've been able to successfully advocate for that. And when next time you're registering for classes or feeling a little stressed, if you have a reminder and a quick button to all of a sudden get connected to resources and tools and things that you can do in the moment, like some of the breathing exercises we did, if that could make you 3% less stressed in the moment, maybe 5%, maybe 10%, but you did that week over week or month over month, that can have a huge impact, not just on yourself, but your community. So they did a lot of social. They actually made their own Instagram handle, which has been pretty cool. They've been making content and flooding it. But the results have just been incredible. And that we have over 163,000 users from that system. Again, it's all voluntary. We're not forcing students to do that. So there's an appetite for this information. And the average time on site has been over 6 minutes. So the average time on site for a website is actually between 8 and 30 seconds. So when we see this hovering around 6 minutes, we know that students are actually engaging meaningfully. And we actually are just coming up to the 20,000 mark of getting folks to take those assessments and raise their own awareness. And Fullerton wanted to know, like they took our word for it, but they wanted to do their own research to say, does this thing actually work? So I actually didn't make this slide, they did, hence the great image right there. But they did a research study on their institution, and they found that overwhelmingly students said that they like the tool, it's relevant to their identities, they're learning new skills, and they're practicing new skills. These are all things that we want everyone to be working on, and it's making it more accessible so that you can do it while you're taking the link from one campus to the other. It's not a big thing that you have to do and take out a bunch of time in your day or schedule to help promote your own mental health or well-being. And then we also have some other great stats, which I'm just going to keep moving forward because it works, it's good if you go in. But I really wanted to spend a little bit of time, and I want to have plenty of time for Q&A, but I wanted to talk a little bit about helping peers. So I just want to see, does this feel valuable to folks? When it comes to mental health, I know at dinner it sounded very much of interest of how can I better support a friend who may or may not be coping with mental health? Folks agree this would be helpful? Yeah? Okay, awesome. So, first question. How do you generally feel about helping a peer with an urgent mental health matter? Again, it's anonymous. Please don't feel shy to being honest with this one. Great, this is pretty awesome. A lot of people actually feeling pretty confident. A lot of times when I present and ask this question, it's actually stacked just the opposite way. So it's really cool to know that folks are feeling, pretty good about having these conversations. And that's nothing to be said about folks who are saying, I feel a bit intimidated. I know in college I was incredibly intimidated about having any conversations like this, but this is really helpful for me in going through these slides, so thank you. So again, I'm going to keep this high level. There are literally like 3 to 5 to month-long workshops that you can go to that will help you really be able to talk and have these conversations around an individual in a state of crisis. But I really just wanted to boil down the most basic of things. So the first is, it's really important to know that you don't have to have all the answers. I know for myself, and I've done a lot of training of primary care providers around suicide prevention, because sadly, a lot of primary care providers are also intimidated by asking that question, and you ask them why they don't, is they say, if I ask someone if they've been thinking about suicide in my office, if the answer is yes, I have no idea what to do. So what we did was actually give them a protocol. Just like if someone's having a heart attack, you have a protocol. Here's your protocol for if someone is having acute suicidal ideation. But that's a little bit of a digression. You don't have to have all the answers. That is totally okay. The only mistake you can make is not saying something. Really sadly, and some of the hardest conversations I've had are folks doing postvention after a suicide loss of folks saying, I should have X, or I could have Y, or I saw A, B, or C. And if you can't ask that question or offer that support, find someone who can, whether it's a friend, whether it's a counselor, whether it's whatever it is. But when folks are in this state, it can be really hard to reach out for support, and sometimes being that helping hand can go such a long way. And what you're seeing on the right-hand side of your screen is actually a campaign that we did. Summit County, Colorado is where like Vail, Breckenridge, all those are, and they unfortunately have a very high suicide rate. And what they realized is the population is largely transient, so there aren't a lot of deep connections. So it's very hard for someone to have that conversation, because a lot of times people, when I'm a liftie for the season, don't feel connected enough to have what feels like a very personal conversation. So we made these e-cards, which are really light and really good reminders that it's okay to broach that subject, even if you're not best friends. It's okay to offer support, just like you would if you saw someone who fell down in the middle of the street. You'd offer them support. It's okay to do the same, even if you're not best friends. And these have actually been so highly used. It's been one of the more fulfilling things that I've done, seeing how many times these are clicked through and how many people are actually reaching out for support and having meaningful conversations about mental health, all with a very, very simple thing. So when to offer support? That's a question that comes up time and time again. So here's a few signs that someone may be experiencing some mental distress. Whether it's withdrawal, it's a very hard word for me for some reason. So, maybe I'm an athlete and I've been missing practice or haven't been lifting or I've been missing class, whatever it might be. Changes in appearance, making consistent comments about just being overwhelmed or lost or wanting to run away or disappear. Increased substance use, increased frustration or anger, as well as increased confusion or lethargy. But most important, one of my favorite professors, he gave me this advice and it stuck with me and it just resonates, is trust your gut. And he said, if something makes you go boing, if it gives you that just feeling in the pit of your stomach, there's something there. So listen to that feeling. If you're having that feeling, trust it. Something is likely wrong with your friend or peer or roommate. And do what you can to have that conversation. And in doing so, here are just some quick tips, and I'll make sure that this is available so you don't have to remember this. But very simple things that can be really easy to forget, especially when you're living in a residence hall. Having this conversation in a private setting is so important because it can feel really embarrassing and vulnerable to talk about something as, intimate as our mental health if other people might be around hearing it. Also, be very clear that you want to help. Make sure that there's no mistake that I want to offer my support in whatever way I can. Also, do more listening than talking. When folks are in this state, it's not helpful to just give advice and sort of rant and say what I would do or what you should do. Really just listen, and then be curious and empathetic. A couple of things that are big things we want to avoid are not to express judgment. I think that goes without saying. But unfortunately, sometimes we can unintentionally express judgment just with our tone or accidentally saying, well, why didn't you just reach out? Or why didn't you tell me sooner? It can be really important to just check that at the door. And then also don't rush the conversation. So if you know you have to run to class or get to practice, and you have 5 minutes, that's probably not the best time to broach this conversation. And then always, to the extent you can, plan some sort of check-in or next step, whether that's with yourself, whether it's with an RA, someone in the counseling center, whatever it might be. But that can go a really long way to be very clear in, hey, we agree that this is going to be the next thing. So you're not worried about walking on eggshells for the next week, figuring out when you might have a follow-up conversation. So these are so cheesy, and I want to acknowledge and own that, but these are some ways that you can sort of start to broach that subject. Whether it's you haven't seemed like yourself recently, is everything okay? Super simple, but really effective. I know that you've been missing a lot of class lately. Is there anything I can do to help? I'm sorry you recently lost your grandmother or grandfather. I'm really glad you told me. Have you ever considered reaching out for additional help? So again, I know these are super corny, and this is also corny, but I'd love you to bear with me. Turn to the person next to you, and in your own words, try and ask one of these questions, because it can be so hard to do so and really intimidating. So I'm going to give you each 30 seconds to try and ask some version of this question to someone next to you. Go ahead. Use your own words. All right, I'm going to pull us back in. Just curious, how did that feel, folks? How many people were totally comfortable asking that in some way, shape, or form? Awesome. How many people felt, not terribly uncomfortable, but kind of uncomfortable? Yeah, it's a tough thing to ask. And how many people were neutral? I can do it, I can stumble through it, but got it. So it's a really good skill to have in your back pocket. And I was a soccer player, so just using a free kick as an analogy, the reason we do that so many times as practice is so that when it's in the game, when the pressure's high, I know exactly where I'm going to put the ball. I know exactly what I'm going to be doing, so I'm not fumbling around thinking of all the little things that I need to do. I'm able to focus on that task. So as silly and as simple as it is, one great way to just help yourself be better at that is maybe do it in a mirror once in a while, just to be able to try and have that conversation so you know what words you're going to say and you're less worried about that and you can attend to a person in the second. So again, I really want to reinforce this. The only mistake that you can make is not doing anything. So if you think someone is coping with a mental health challenge or is in acute distress, do your best to go out of your way. If you don't feel you can have that conversation, it's okay. Just find someone that can. And remember, really, help can be as simple as listening. There are hundreds of accounts from suicide attempt survivors who said that if someone would have just listened, I would not have attempted. And that's so important that just being there, literally just having 2 ears, can be the impact that we want to have in that moment and help someone connect to support. So I want to get to lessons learned and key takeaways from my perspective. You can make all your own. And then would love to move into some questions and answers. But first, I hope that through the conversation today that I planted some seeds that say, you know what? This is a time and a place that I want to try and be more proactive about my own mental well-being, whether it's adopting some breathing techniques or expressing more gratitude, whatever it might be. But also I want to try and push the needle on what my community can do. And again, I think Student Senate and so many people are driving that, but Student Senate can't solve this for your whole student body. What we need is folks really rising up and saying, this is something we care about as a community. We want to make sure that tools are included on the LMS, that we're providing outreach to incoming first-year students, that we're including mental health information on all of our meetings and sports teams and things like that. So we have to do this collectively if this is where we want to go. Additionally, we really have to elevate the conversation. It can't just be happening in Mental Health Awareness Week. I love Mental Health Awareness Week. I love Tobacco Cessation Week. I love all those things. But what if I want to quit smoking? Not during Tobacco Cessation Week or whatever it might be. We have to make it, if we can, a year-long, 24/7, ever-present push to have this conversation be out there. And I would argue that awareness has really been raised. I think a lot of us know that we want to do something about mental health. I think that's why you're all here tonight as my guests. And now it's time to take that next step and say, we're aware, now it's time to take action. And that action can be very small. Again, as I mentioned, having a gratitude journal, encouraging starting meetings with a breathing exercise, whatever it might be, can go a really long way. And then I know we just talked about this literally like a minute ago, but this is one of the biggest take-homes. If you have a friend or a loved one or anyone that you think could use some support, if you can't offer that, find someone who can. It's going to go such a long way. So before rounding out, for those of you who either weren't aware of you at csbsju.edu, I would encourage you and love if you're open to just going to that URL, creating an account, because everything we talked about tonight, from assessments, from ways to motivate your community, to self-help tools, to goal setting, is all within this platform. And it's something that you should be really proud that your Student Senate brought to you all to elevate this conversation about mental health. So I hope you're all willing and able and interested in doing so. And I'm so interested if you have thoughts, feedback, things you wish you were in there, things you think you could contribute. We love hearing from and working with students. We take that super seriously and always try and push the needle on things. So please don't be shy in reaching out. And I would just like to say thank you and offer to answer any questions that anyone might have. And I do mean it. That's my email. I check it like every minute of every day for the most part, which isn't great for mental health, but what are you going to do? Reach out if you have questions, or I can be a resource in any way. So thank you, and I'd love to take any questions if there are any. If you need to think about it, that's okay too. Yeah, please.
So I'm not from Minnesota, but I've been told that seasonal depression is a really big thing. What are some things that students should do to sort of like help them through that phase?
Yeah, it's a really great question. And seasonal depression can mean a lot of different things for a lot of different people. So there's obviously like underlying biological pinnings for seasonal depression disorder. It can also be, it's a really stressful time of the year. Starting in October, when the days get shorter, that's like arguably the busiest, most stressful time of the semester. But a couple of things. So one is getting out for natural daylight. This actually can help with any form of depression. If you can get out and go for a walk in the morning, that's one of the best things that we can do to help prevent depression, which is so simple, but it's a matter of carving out that time and making it a part of our routine. The second thing that's so important, and this isn't just for seasonal affective disorder, this is for anything across the board. A lot of times when we get stressed, anxious, down, whatever it might be, the first thing that goes out the window, ironically, is our self-care. Again, for myself, it's being outdoors, it's playing soccer. But when I'm busy, those are the first things that fall off my to-do list because it's more important to take care of kids, to do work, to do all those things. But that's my release. If I'm just redlining all the time and not giving my brain that break that it needs, I'm just going to keep redlining until something happens. So we have to push ourselves to turn the volume up on our self-care, not down when we start to feel that way. Again, whether it has to do with seasonal affective disorder or anything between. But the last thing is counseling works. Our research shows it through and through. You have an amazing counseling center here. And if that's something you or someone you know is coping with, tap into that resource. It's free. You can get all the support you need. And going to therapy doesn't mean you need to go to therapy forever. Just like with, you sprain your ankle, you might need to do physical therapy and learn some tips and tricks to get that ankle strong again. And maybe that's all someone needs. Maybe someone does need something a little bit more. But reaching out for that form of support can go such a long way. So thanks for the question. I hope that helped. Yes?
You touched on this a little bit just a second ago, but you're doing a lot for other people. How do you take time for yourself?
It's a great question. So for me, getting outside is like my thing. And unfortunately, with 2 kids and work and all the things in between, I find myself mountain biking at 10:30 at night sometimes. I got myself literally a car headlamp that I mount on my helmet, and that's what I do. But that for me is my outlet. The second thing is connecting with people. So I am very much a people person. I'm very extroverted. And that's another thing. So with all my friends, they know I can hang out at 8:30 or after because that's when my kids go to bed. So it's hard, but I've been able to prioritize that, even at the expense of other things, but just have to make it a priority. Thanks for the question. Yeah, in that.
So what would you say, I kind of have this problem where I seem to take burdens for other people's problems whatnot. I try to help them, maybe a little, I don't know, maybe a little too much is the right word to say, but I almost feel like I take them on as my own problems. What would you say is the best way to help with that?
Yeah, it's a great question. I think it makes total sense. First, I can personally relate to that, and my guess, how many other people in the room can relate to that feeling? I am not surprised by that whatsoever. With a very motivated student body, high achieving, that's something that is so common amongst folks. So for myself, one, it's really differentiating what you can and what you can't do. And I think, again, please pardon this answer, but I'm a clinical psychologist. I think it can be so helpful to understand where those feelings are coming from. Because for some people, they might come from family dynamics. From someone else, it might be a trauma. For someone else, it might be something in between. But I think the most important thing, which is awesome, you already have some awareness around it, is starting to recognize more consciously and proactively of when is my helping someone negatively impacting my own well-being, and where are those lines I need to set, and maybe even communicating that with someone can go a really long way. Of, I have this real desire to help you, but you know what? It's bringing me down, and that's a terrible way to frame it. But it is causing me stress in these ways, and I think people can also hear that. But I think understanding it, being aware of it, and I wish I just had a pill or something I could be like, hey, take this and you're good. But human behavior is very, very complex, and the last thing I would encourage, you saw how many people just raised their hand. My guess is other people in this audience also have some great stories and tips that could also be super helpful. Yeah, thanks for sharing that. Other questions or thoughts? And it's okay if not, too. All right, I'd love to end with one thing. Going back to, how did that happen? Well, turns out I forgot to clear that from whatever I presented at last or a test, but gratitude goes a long way. So, I don't know what that is. Masship, huh. But what's one thing you're grateful for in this moment? It can literally be something as simple as the shirt you're wearing, the person you're sitting next to, anything in between. This goes such a long way in helping our mental health. If it's multiple words, you either have to use an underscore or not do multiple words. I'm sorry. I also hate that my name's up there. That makes me very self-conscious because I did not try and do that, just for the record. Campus, friends, family, living, people, Senate. Annie. We also have a birthday up here. Just saying, just saying. Awesome, well thanks for doing that. As we wind out, I'm gonna leave this up so you can keep typing this in, but I'd just love to give another huge thank you. I hope you found this helpful in some way, shape, or form. And you should all really be proud about the momentum you're getting and your student senate is leading on this conversation about mental health. So thank you all so much for your time and for being here on a Monday night.